and let folks slowly continue to join. Hi guys, thank you all for joining today live. Really excited to have you here for our third webinar with Rupa Health. So excited about this partnership. I'm going to be representing Healthie today, and today we're speaking to empowering patient-centered care and figuring out how to transform lab ordering with Healthie and Rupa through our integration. Really excited to speak to Rupa Health here, which is making lab ordering extremely efficient and easy from partnerships with 30+ lab companies. Healthie itself is helping digital health companies deliver modern virtual first experiences and building long-term relationships with your patients to deliver patient-centered care. So let's figure out what we're going to be discussing today. Our agenda first is going to be figuring out how to maximize Healthie and Rupa workflows with Jenna. We're going to then be diving into more ways to support patient care with a fireside chat with Dr. Kate Henry. And finally, we'll be leaving about 15 minutes or so to have questions at the end and discuss some follow-up resources. I'm really excited to have both Jenna and Dr. Kate here because they are both current and former practitioners with a wealth of experience with regards to creating workflows through your Healthie and Rupa integration. And Matt here as well, who is an onboarding specialist with Rupa, also has a wealth of experience and is going to be helping us answer some questions in this chat. So let me go ahead and pass it over to Jenna, who's going to be speaking to Rupa Health.
Hi, everyone. So excited to be here. Thanks for the introduction, Pri. As she mentioned, I'm an onboarding manager here at Rupa Health, and I'm just super excited to go over the Rupa platform, the Rupa experience with you, and show you how quick and easy it is to order, track, and get results for all of your lab ordering. So for those of you who know nothing about Rupa, maybe you're brand new to learning about us, quick introduction. We're a comprehensive lab ordering platform. And what that means is you can come to Rupa, you can have no pre-existing accounts with any other labs. You can log in with one login and do all of your lab ordering through 30 different companies. So it really streamlines that process. And then beyond actual lab ordering, we have built out a workflow that handles all of the in-between. So from the time of ordering labs to the time of waiting for results, we will drop ship kits to your patients. We provide your clinics with in-office kits if that's the workflow that you utilize. We help patients with collection instructions, requisition forms, and then we also send them phlebotomy options based off their zip code of where they can schedule their blood draw. And then my favorite part about Rupa is we actually have a live support team that you and your patients can utilize. So if your patients have questions about their kit, collection, phlebotomy, maybe they received their kit, they did the collection all wrong, they need a new kit, that's something they can come to us for rather than bug you. And the goal here is just to give you back some of that much needed time to then spend with your patients. So slide, please. So why is this important? So for those of you who are already ordering labs, I'm sure you're painfully aware that there are several not so fun parts of ordering lab work. We've listed a lot of them here, but having to log into multiple accounts with multiple logins to manage all of those orders can be really time consuming. Handling the payment portion of things, keeping all of that straight, practitioner pay versus patient pay, insurance versus cash, it just all gets really confusing. And again, takes up a lot of time. Providing phlebotomy for patients, and then helping them through those requisition forms, collection instructions, and sample issues. All of that we have created solutions for on Rupa, and I'm going to highlight them today when we go over the platform. Slide, please. So you'll see here, we have built out the platform in a way that is meant for you to save up to 15 hours of admin work per week, starting with placing that order. The process is really quick and simple. You can place an order within 2 minutes. And then we handle all of that in between. And it's all free to practitioners, which is amazing. So one thing I did want to touch on before we hop into the platform, slide please, is who Rupa is a good fit for. So I like to highlight this because it can be confusing at first to decide, what platforms to use, what services to use. Is it a good fit for me? And the thing I love about Rupa is our platform is really customizable. You can really customize your experience to meet your specific needs. So whether you're a brand new practitioner, maybe you've never ordered labs before, I still implore you to sign up for Rupa. We have an amazing free educational platform. It's going to be the best way to kind of dip your toes into lab ordering, explore the catalog, and learn about, what options you have available to you. On the other side of the spectrum, if you're a practitioner working in a multi-prac clinic, you're seeing, tons of patients a day, your office manager is handling hundreds of lab orders a week. We have customizable settings to really maximize your workflow on Rupa and hopefully save your entire clinic lots of time and lots of hassle. So without further ado, I'm going to go ahead and share my screen and dive into the platform. Awesome. So here we are in the Rupa dashboard. When you initially log in, this is going to be where your patients eventually live. This is where you can manage orders. You can see the status of orders here at the top, and you'll have several capabilities from the dashboard, which I will highlight in a bit. But first and foremost, I of course want to get you set up to integrate with your Healthie account, which is really quick and simple. If you head over here on the left-hand side to settings, you'll click into clinic settings here and you'll see a dedicated section for EHRs and integration. If you head over to add integration, you'll see Healthie here and you're simply going to connect EHR and then connect. Really quick and simple. Once those are connected, the beauty of that is you're going to not only be able to place orders and manage results on Rupa, but you can also do that from your Healthie account. Once results are in, they're going to also populate to both accounts. So you're not having to, upload results manually. So once you've signed up for both accounts, you've got your integration live. I want to show you how quick and easy it is to place an order on Rupa, which you can always do by utilizing this start an order button in the top right corner. Now on Rupa, we just require a patient's first name, last name, and email to place an order. So this is going to be if you're creating a new patient. However, if you're syncing with your EHR, your patients will also blend over from that as well. So I'm going to select a patient. It's going to bring us to our ordering page. Just want to make sure. Cool. Within the ordering page, you will have the ability to create custom test bundles. You can also use this heart icon to favorite your go-to test. You're always going to have the entire catalog available, but again, this is just another workflow time saver. That way, once you've created your panels and you've favorited those tests that you're always utilizing, you really don't have to utilize the catalog each time. So I'm going to throw a GI map into my cart over here. You have several ways to customize this order, but ultimately you're going to scroll down, send to patient, and you're done. So you can see once you've gotten the workflow down, once you've created your bundles and kind of honed in on what test you're going to be ordering, it's a really quick and simple process. Once you've placed your order, I do just like to show y'all what your patients will see on their end. Because we do provide a really seamless experience for them. And I think it's helpful to know that your patients are in really good hands from the time that you've placed that order. So you've placed that order. Now your patient's going to receive a confirmation email from Rupa. And this can take two forms, whether your patient is paying for the order or whether you or the clinic are paying. The email will differ slightly. So this is going to be patient pay. So you'll see the patient's going to provide their shipping details of where we're going to ship that kit. If we're doing a drop ship method, they're going to provide consent for the order and then payment. When paying on Rupa, this is another thing that I love about our platform. They have options. So they can utilize credit and debit, but we also take HSA, FSA, and we have a 3-month payment plan that's interest-free, which can be super nice to break up some of those more costly specialty tests. Now, if you or the clinic are paying, you'll see a very similar email is sent out. We just don't disclose that pricing, and we obviously don't ask for payment because that'll be handled by you guys. but they still will provide their details on where we'll be shipping that kit. Awesome. Once payment is received within 24 hours of payment, we notify the payment or the patient that their kit has shipped with an expected arrival date. They get a nice personalized instruction page, how to complete their kit, how to fill out the requisition forms, and then again, how to schedule their blood draw, which we will send them 3 to 5 phlebotomy options based off of their zip code. This is just highlighting those sample requisition forms. We really make it clear what to fill in and what to leave blank, making that process super easy. And then we notify you via email once results are in. And then lastly, this is just highlighting again that customer support piece that I mentioned. You or your patients can utilize this if there's any hiccups or questions along the way, and our team will handle that for you. So I'm going to go ahead and dive back into the dashboard. That's the ordering process, really quick and simple. That's like our product one. That's if you do nothing else but lab order and Rupa, that's the experience, the workflow that you're going to expect. However, we have built out several other capabilities that I wanted to highlight. The first is going to be managing those results beyond just the status of the order. So once results are in, if you click into the existing order, you're going to have lots of capabilities. So the first one I want to highlight is scheduling a clinical consult with the lab company. So this allows you to still schedule time with the exact company. For this instance would be Diagnostic Solutions. If you have questions about going over the lab, or just have questions about the particular results you got back, you can schedule directly from Rupa. You can also send those results directly to the patient or download them from your own records. Also within this ordering page or order results page, one of my favorite features on Rupa is going to be the create results summary. This is another great tool to incorporate into your workflow that I find to be just a huge time saver. So what it does is it actually generates the lab report on the left-hand side. And then on the right-hand side, it allows you to create a custom takeaway that you can send to the client. So you can talk about maybe your first few visits, maybe symptomology that prompted testing, and then it allows you to highlight specific biomarkers from the report. So you are actually handpicking these. We put them on these nice visualization spectrum so that it's really clear to the patient where they lie. And this is a way for you to kind of decipher what's really important from this report to the patient. That way they're not sifting through this multi-page, somewhat confusing report. And it just makes it a lot easier for the patient. And then down below, you can actually create a next step treatment plan. So we have several pre-populated tasks such as additional lab testing, medication, nutrition supplements, or you can always customize your own. Once you've added your tasks, again, you can email this directly to the patient or download it for your own records. So it's just really streamlined, really quick and easy. Awesome. So that is the ordering dashboard, the workflow for placing an order and then creating those custom result summaries. Beyond that, I do want to touch on just how to navigate the catalog real quickly, and then how you can customize your experience here at Rupa, depending on where you fall on that spectrum, whether you're a brand new practitioner and you're not yet ordering, or whether you're working at multi-practitioner clinic. We have several ways that you can customize your experience. So first, let's just quickly look at the lab catalog. You'll see that you can browse by health category, lab company, sample type, or you can simply just do a keyword search here. A few things to note: whenever you are searching in the catalog, just know that it automatically populates by popularity. So if you're in need of a GI test, this first page of GI test is going to be the most ordered on Rupa out of the 162 that we offer. So that helps to kind of streamline your exploring process, I find. And then another great tool for deciding what tests you may utilize for a patient is going to be our compare test feature here in the top right corner. So if you hop into compare tests, again, I'm going to just stick with the GI theme here. If you're just unsure, the differences between different lab companies, what tests might be best for your patient, I recommend just coming in here and highlighting whatever test you might be interested in for a patient. You can add as many as you want to the comparison. I'm just getting a few from different companies. And then it'll automatically generate a line-by-line comparison for you where you can compare price, sample type, sample reports, instructions. My favorite piece, though, is if you scroll all the way to the bottom, it gives you a nice comparison of what biomarkers are included in each test. So it allows you to get really granular for your patients. And like I said, make the decision that's best for your patient's needs and your practice. Next, I'm going to hop into settings here. Excuse me. So within settings, this is where you're going to have a lot of customization. So first and foremost, I did want to highlight a feature we have called physician services. I mentioned that we cater to all practitioner types. That means that the ordering capabilities of the practitioners that we work with really varies. So for instance, sometimes we're working with MDs who are going to order everything under their license. Sometimes we're working with health coaches or registered dietitians who maybe they have a telehealth practice and they're only licensed in one state. Physician services allows you to apply for this and still recommend testing for scenarios where maybe you're limited based off of your lab ordering access, I should say. And what this allows you to do is still recommend those tests. And then at the time of placing an order, a authorizing physician actually reviews and signs off on that order. So great feature to utilize if that's something that you're in need of. Beyond that, under personal settings, custom test bundles is where you can come in to create those custom panels. So we actually already have a panel library. You can view existing bundles. You'll see over here some examples, or you can totally create your own from scratch. It's really simple. You'll simply hop in here, give the bundle a name, head into our catalog and just choose the biomarkers that you want to add to that bundle. The nice part here is once this bundle is created, it's going to be saved in your favorites. It's going to be available for all future orders. And that way you're just throwing it into your cart for a quick checkout. Within clinic settings, we kind of touched on this before of where you can find that EHR integration, but just want to highlight that one more time. You also have the capability of stocking kits in office on Rupa. So like I mentioned before, with the patient providing their shipping details, we can drop ship kits directly to patients. However, we do work with clinics that see a lot of patients in person and they like to have those kits on hand. Here is where you can do so. So you would come into settings and simply toggle this option on. And then I will touch on how to order those supplies for your clinic if that's the setup that you have. Beyond that, if you are a multi-practitioner clinic, or maybe you have office staff that is going to need access to Rupa, here is where you can invite all of your team members. So like I mentioned, if you're a growing clinic, you have a lot of orders, this is where the customization of the workflow really comes into play. By inviting team members, you guys are all going to be functioning under one dashboard. Everyone's going to have their own login and password. However, when you log in, you're going to see all of the existing orders, and that way that point person can really help manage orders moving forward, status of results, etc. Within notifications, you can also delineate one point person. So if there's someone in the clinic that you want to receive all the updates, results, emails, and notifications, you can do so here. Billing and custom fees. So like I mentioned, you have some options when you're checking out on Rupa. Your patient can pay, and they're going to have all those lovely options that I mentioned. However, you can also pay as the practitioner or as the clinic. If you operate this way for all orders, you can actually just set this as the designated default cart preference. So by clicking this on, it's going to be practitioner pay as default. You'll upload your clinic card, and it's going to use that form of payment moving forward. If you're wanting to add a custom fee to the order, maybe a lab interpretation fee, follow-up fee, you can add this here. And the nice part is it's completely customizable. So you can change that lingo as well as the line item amount. If you handle phlebotomy in your clinic, if you provide that service to your patients, you can actually come in here to preferred phlebotomist and add yourself as the preferred phlebotomist. This way, we're automatically going to list you as the option moving forward. And then if there's ever an instance where maybe you're a hybrid clinic and you do provide phlebotomy in-house, but then you also have some telehealth patients who live elsewhere, who don't live in the area. In that scenario, if they live greater than 25 miles from the clinic, we're still going to send them those 3 to 5 phlebotomy options from them to choose from of where they can schedule their blood draw. So like I said, really flexible and customizable depending on your needs. Awesome. So lastly, I just wanted to show you all how, if you're operating with in-office kits, how to order those supplies. So we already toggled that on in settings, which is going to make this in-office supply tab active. So you're going to have this order in-office supply capability. You'll hop into here, you'll provide your clinic details, you'll select which lab company you're wishing to order supplies from, and then you're simply going to select the supplies that you want. You'll place that order. And then once you hop into your supply dashboard, you'll see the status of that shipment. And then moving forward, if you find that that amount of supplies and variety of supplies really worked well for your clinic, you can simply just reorder moving forward rather than toggling through to pick all those supplies the next time around. Awesome. Well, that is the platform in a nutshell. I know I covered a lot of information, so definitely I'll stick on after for question and answers. But for now, I'm going to go ahead and hop it over to Dr. Kate for her to chat a little bit more about Rupa and Healthie.
Thank you so much. Hi, guys. So in the chat, real quick, can you guys put what type of practitioners you are? Am I talking to RDs, health coaches, MDs, DOs? We have a lot of different folks using Healthie. And I used Healthie in my own practice before coming full-time to Rupa. And so I would love to know who we're talking with today so I can tailor this a bit more to you. We've got some dietitians, nutritionists so far. So one thing I wanted to talk to you guys about is lab shops and food plans. So if you're nutritionists and dietitians, how many hours a week do you guys spend meal planning? I just want to know. And while we're collecting answers, I'm going to introduce you to the meal planning tool. Can you guys see my Rupa screen? Love it. 10 or more, Susan. Okay, I'm about to save you a lot of time. So when you go into the back end of Rupa Health, what you'll see is the food plans beta. When you click on this, you can add a client, and then you can specify how many times you want them to eat per day, what you want their diet plan to be. If they've got any preferences, so maybe like they really don't like certain foods, they need a gluten-free, dairy-free, egg-free plan, they need a certain amount of calories and nutrients. All you do is click generate plan. And in under 2 minutes, you have a 7-day plan that meets all of these requirements. Now, if you guys are anything like me and you're doing custom meal planning, you know that typically designing a low FODMAP, Mediterranean, gluten-free, dairy-free, egg-free, 1,800 calorie, 100 grams of protein, 3 grams omega-3 meal plan would take hours, particularly if you have a picky client or a client who only eats certain types of cuisine. So you'll notice how fast this is, and the fact that it comes with serving sizes. So this saved me hours in the clinic when I was meal planning for folks. And so I wanted to make sure you're aware of this. This service is free. And so once this is done populating, a couple of things that you can do are refine it. So you can, if you're screen sharing on Zoom with your client, or if your client's in the office, you can show them this, go through it together and think like, what's going to work here, what's not, refine it, and then send this to them or print it out. And it stays in their account. Yeah, Susan's like, my mind is blown. I know that's how I felt. So what we're doing at Rupa is listening to you guys, figuring out what you need, and then designing it for you. And if you guys are functional medicine or nutrition practitioners, you guys know it's hard out there. Like, you're usually running your own practice. There's a lot going on. You're doing a lot of admin. You're doing a lot of problem solving. And our wish generally is, I wish somebody would come in and like, just help me or save me time or design a tool that lets me do this more easily. And so I think food plans is something that you guys are going to really value. And it's going to add a lot of value to your practice. I know I have mine hanging on my fridge, and everyone who comes in my house looks at it and goes like, can I have a copy of that? Which is really cute. So, and you can put your logo on it. So once this is done populating, I gave it a lot to work on, so it's taking a few seconds longer than normal. but you can download it and print it with your logo on it. And so it is kind of cute. It'll be a little source of advertising for you on your client's fridge. But again, this is something that can save you time. And then lab shops. So how many of you, like, one of the things we don't charge people for is the random phone call to the office being like, hey, can you order me a vitamin D? I know I was just in 2 weeks ago. Can you order me that? With lab shops, you can now have patients order their labs a la carte. And here's what I mean by that. So in the Healthie platform, and I used Healthie, you guys know I love Healthie, but you know what, this probably isn't the best lab shop, but that's okay. We'll show you a couple different examples. The Healthie platform, I love that I could order labs, but ordering custom lab bundles was somewhat complicated. And I was really grateful when we had this integration with Rupa. And what made it even easier was having a lab shop. So with a lab shop, you can make a landing page, kind of like if you guys have full script and your clients can go find your full script and then go in and order not only what you order for them, but then go search your catalog or the entire catalog and order what they need a la carte. You can do this with labs. So somebody could come in and order their own thyroid panel between visits, and then you both get the results. So you get their results and then they get results. And so you're able to do that without having to order it yourself, which is huge when you're trying to save time. It's also empowering your clients to go and learn about their own health on their own time. This is something that you can pair with an asynchronous course. And so if you have a Eat Right for Your Thyroid course, you can pair these labs with that course. So when people buy the course, they can buy the labs and go through it. And then when they come see you for the appointment, you don't have to spend a ton of time educating them or ordering them labs. You just start ready to hit the ground running, make the most of their money, your time. It's really awesome. And so this is another feature that I think as Healthie users, you guys will really love. We have a phlebotomy map. We have some really cool ways to learn about labs. So if you're a nutritionist or a CNS, you might be in the boat where like maybe you don't have functional medicine training yet, but you want to learn more about, for example, like how would you do food sensitivity or mycotoxin testing? And so what's really brilliant is that in these compare labs, we've already built you several comparisons where you can look at the different types of mycotox tests on the market currently. And this is a really beautiful way to do informed consent with your clients. You can sit down with them and say, here's your 3 options for testing your urine for mycotoxins. Here's how much each of them costs. Here's how much each of them takes to get to you. Here are all the biomarkers that are included in each of them. So here are the things that we can test. You can copy the link to the comparison and send them home with it if they're not ready to make a decision right then. And again, this really empowers them to go home and have a conversation with their family when they're thinking about the tests that they want to order for their health. The other thing that we've created for you guys, anytime you're wondering, for example, like, let's say, you know how to treat thyroid, but you're not quite sure how you'd use nutrition to treat your Hashimoto's patients. You can figure out what labs do you run on Hashimoto's patients. How do you make a functional medicine protocol that treats the root cause of Hashimoto's once you find it with the labs? So most of you know it's really hard to find these protocols and this information online. We've built that for you. We have several full-time on-staff clinicians as well as an expanded author team who work really hard to create these articles so that you guys have free resources at your disposal to help your clinicians. This is just some of them. So I'm here to answer your questions as a practitioner who's used Healthie and Rupa. So I'm going to stop sharing and then let's just hear from you guys. I am a naturopathic doctor. Thanks for asking. But yeah, give us your questions. What are you guys wondering? What are some of your questions about how you'd make this work in your practice? And then if you don't have any questions, I'm also happy to teach you how we're creating free marketing materials for you guys if you want to learn how to build and scale your practice. I'm not sure how many new practitioners are on this call.
Looks like we had an attendee raise their hand, Ursula Kirby. Do you want to throw your question in our attendee chat? I've just gone ahead and opened it so that everyone can chat any questions live. All right, Crystal, I'm actually just going to allow you to talk manually so you can ask your question live.
Can you hear me?
Yes.
Okay, so I'm a new practitioner, so I would like more information on marketing, on how to grow my business.
Kate, you're on
Dr.
mute.
K, you're muted.
First, learn how to use technology. Just kidding. Don't be like me and not know how to unmute. Okay. So, great question. So, and again, guys, I want you to throw your answers in the chat too, because we're all here to help each other. A lot of what happens when you first start and you open your doors is you have a lot to offer your community, but nobody knows that you're there. So the first step is letting people know that you're there. And then the second step is convincing people that you know what you're talking about, that you can help with their problem, that you're someone that they can trust. Because if are you a nutritionist? What type of practitioner are you?
Nutritionist.
Nutritionist, great. And do you have a particular focus?
Well, functional nutrition.
Amazing. Okay, great. So typically when people are searching out a functional practitioner, they've already tried the traditional system and have typically not found what they're looking for. And so building trust with these clients and then establishing what you can help them with is really important. And so let me give you an example of how you do that. Let's pick a particular example. So do you have a particular focus, like women's health or GI health or autoimmune disorders, or are you just kind of like, I help everyone with nutrition?
Well, I think mine is more, I added in cancer. I added in preventative health. So I think it's more geared around preventative health, and I think I added in cancer, like dealing with cancer patients. And more
Awesome.
preventative. I think that's what it's more, because mine is also public health. So I'm all about prevention. So I
Love
added
that.
in that. So a lot of my clients may be either cancer patients or maybe the elderly.
Great.
Because maybe the elderly who may need cardiology screenings or diabetes prevention or education, that type of thing.
Brilliant. Okay. So here, let me show you how this could look in real life. Okay. So this is my old, I haven't updated this, but this was my old practice landing page. This looks different now because I'm not trying to get clients, but everybody who's listening should have a website and at least a blog and at least an about section. I also want you guys to have a stories or like proof that it works section. Because when people land on your site, they're likely comparing you to a bunch of other practitioners. Again, they may have had some negative experiences with other practitioners. And so people are generally landing on your page wondering, does this person know what they're talking about? Can I trust them? Does it work? I want to see the proof. And are they a good resource for me in general? So the one way you can prove to people that you know what you're talking about and you're a good resource is to just use your blog and a newsletter to consistently post great content. And if you don't have time to create that content, just use ours. The reason that we're creating this for you is so that you can sort of repost a lot of this stuff. So for example, we had this doc write up complementary and integrative medicine approaches to oncology and gerontology, which is perfect for you, right? So what you could do is take this article or a part of this article and put it in a blog post and say like, hey, did you guys know that a diet high in processed foods, refined sugars, and unhealthy fats can contribute to inflammation? I can help. Schedule your free discovery call. So whereas this would have taken you 8 hours to write up on your own, you don't have to reinvent the wheel. Just take this article, put it in your blog post, send it out. And then when people land on your page, they're going to see that you have this article in your blog. And they're going to start to feel like, okay, yeah, this person knows what they're talking about. With stories, we have case studies that we've published on Rupa. These are mine, but you can also use other practitioners. So you could find like a case study about someone with fatigue, for example. And what you could do is in your proof section, if you haven't written up any case studies yet, what you could do is say like, wondering how a functional nutritionist could help with your fatigue. Read this story, right? And take this story and put it on your website so that people can see, what do functional medicine practitioners do when they're working up fatigue? What types of labs would they run? What types of interventions would they do? And you could post this with your thoughts. The other thing we're doing all the time is sharing a ton on Facebook and Instagram. And so you can just reshare our posts. So many times practitioners who are opening their practices are told, you need to be on social media, you need to be creating content. And that's for two reasons. One, people generally need to see a message 7 times before they act on it. Two, if you want to reach people where they are, the easiest, cheapest way to do it is online, because people are on their phones. They're sad, they're lonely, they're tired, they're on their phone, they're scrolling. And if they come across something from you that's talking about their problem and how you can help, that's a really powerful way to reach hurting people where they're at and to help them connect to you as a resource. And so if you don't have time to consistently create social media content or Facebook content, just follow us on Instagram and Facebook and reshare what we post. We have an entire marketing team that's dedicated to this. And so you can use what they're creating for you. The other thing you can do is give free talks in your area. And so if you're like, I don't even know what I would talk about, like I have never given a presentation, well, start with some of the things in this article, right? Like, take this, make this be your outline, create a few slides, like, take what we've written here and put your own spin on it, come up with your own graphics and start to give free talks in your area. The reason we've invested in this magazine so heavily is because our practitioners need help knowing protocols, but also with marketing materials. And so that's just a very small way that you can use Rupa to grow your practice and save you time.
And this is under your site under magazines.
Yep, rupahealth.com/magazine.
And then I could just take some of the information and just reshare it. It's okay to do that.
Yeah, just say like, hey guys, check out this article on this, or like, you can even say like, pick one of my articles. I'll pick on myself. You can say, Dr. Kate wrote about how to treat ADHD naturally. And I agree with most of what she said, but here's what I would have added, right? And that way you only have to write 3 sentences, but then you can put the link to the bigger article. And so in the time it takes you to write 3 sentences, you can give your clients a ton of content that they can peruse on their own. Don't like copy paste and be like, I wrote this, but just say like, I found this. I thought you guys would love it. I found it really interesting, and we have a podcast too. So if you're thinking my clients don't read, fine, send them the podcast or send them the YouTube shorts that we have that are like 60 to 90 seconds. But people will start to feel like, okay, Ursula knows things. She can help me. She's posting about things that I really care about or that I want to send to my friends and family. And it helps to start to build that trust. I know we've got a lot more questions in the chat, I think. Sorry, I haven't been keeping an eye on that.
Thank you, Kate. That was a great answer. And I think a lot of our questions in the chat were mainly around, how to build your business, how to market using Rupa. So I think that was super, super helpful.
Awesome.
Go
Somebody
ahead.
asked, can you share an example of a patient package that includes the different line items and pricing? I think this might be on Healthie. Guys, on your end, you might be able to show this. In terms of a package, what you could do with Healthie, you guys can create packages in Healthie and programs in Healthie that push out email content regularly. One of the emails could start with, if you have a thyroid package or a thyroid program, the first email can contain the link to this panel where the client can just order it on their own. And then they get the results back in a week or 2, and then they get the next email. Pri, I'm not sure if you want to kind of share your screen and show folks how to do that if they're not familiar with that on Healthie.
I don't know if I can hop into the platform just now, but what I can do is include that in a follow-up deck, include a couple of screenshots there. That sounds good. All right, just trying to see the chat, trying to monitor the chat, see if we have any other questions here. Looks like, okay, so Susan asked about material available to include in client onboarding brochure. So thank you, Jenna, for including that information. Let me see if anything else is coming up here. Let's see. All right, guys, doesn't look like we have any other questions popping up. Gonna leave maybe 2 more minutes here for additional questions. Okay, so it looks like Savannah asked, as a dietitian, do you have any more info on what we can and can't order?
Jenna, do you want to take this one?
I was just gonna say, I can take that one. Yeah, so my best recommendation is going to be signing up for Rupa, because that's really something you're going to work through with your onboarding manager, because it does vary based off the specific license type you have, as well as the state that license is in. So it's hard for me to give a blanket answer. We have an internal tool that we can go over with you and send you resources to make that really easy. And then if we determine, hey, you know, there's 5 labs that I'm really looking to order from, I'm covered under my license type to order them as a practitioner, then you're good to go. You'll just go that route. However, if you're finding there is additional labs that you're disabled from, just given restrictions by your state or given restrictions by your license type, then that would be a good opportunity for your onboarding manager to walk you through that physician services application. It's really quick and simple, and that would get you access to the entire catalog, all 30 labs. Yeah. Let me know if you have additional questions on that, but general answer is we can help you once you've signed up and point you in the right direction.
Thank you, Jenna. Great answer. And I think just a final question in the chat. Dr. Henry, can you share an example of a patient package that includes the different line items and pricing? Need to see an example. Does it make sense to include this in a follow-up, in our follow-up email recording?
Sure. I think that's what I was trying to answer a little bit with, like, what I assumed that this document was the program through Healthie and how they would include this as a line item and then price it. But so that's where I think that synergy could come in, of showing people, like, how would you include this in a Healthie program?
Awesome.
I can also show too, just real quick, if it's a general like lab ordering question of what is included on the line item email that we send the patient, I can just share my screen real quick and re-show that. That's helpful. So this is the email that the patients receive once that order is placed. You'll see over here, this is when you add a custom fee. So they're seeing the price of the test along with that fee you added, and you'll notice it's the exact lingo that you input. So lab interpretation fee, $100, that's the customizable part. So that is going to be dependent on what you enter, and then the total. Other things that could be included in this line item, there are a few companies that charge a shipping fee. If that's ever included, that would also be listed here in the order details. Now, this is for patient pay. If you're paying for the order as the practitioner or clinic and billing your patients after the fact, then that's when there's no line item details. It's simply just the test. And then you, of course, would be handling billing after the fact.
All right. Thank you for sharing, Jenna. I'm trying to see if we have any other questions in the chat. Looks like they've kind of trickled off here, but looks like we are at time. Thank you all for joining today, joining live, asking some incredible questions, which I'm sure have helped the rest of your Healthie community out as well. What I'm going to do is send this recording as a follow-up email. We'll include a couple of resources and answers from some of today's questions in that email as well. But once again, thank you, Jenna, Dr. Kate, Matt, thank you for all of your help leading this session today. Always a great time, and you guys are a wealth of knowledge. So everyone keep a lookout for that follow-up email, and thank you all for tuning in today. Really appreciate it. Take care. Bye.
Thanks, guys.
Bye, guys.